Hello everyone. Now for this video, we will be talking about exercise tolerance test, or ETT, also known as stress test. Now a stress test is an investigation done to measure the capacity of the heart, the lungs, and blood vessels to cope with the extra demands of exercise. Now during a stress test, the patient is asked to exercise by running or cycling so that they put increased demands on their heart. Now, these increased demand may unmask symptoms of angina or other heart diseases that are not normally present at rest, and the ability of the heart to cope with extra stress is monitored using an ECG or an electrocardiogram. The ETT or stress test is used or indicated for the diagnosis of coronary heart diseases, as well as assessment of fitness in certain occupations and medical conditions. Also, it can help to record arrhythmias which are provoked by exercise, but only with those non-life-threatening arrhythmias. Now, who can't do the stress test? Stress testing requires that you exercise usually on a treadmill for an extended period of time and at moderate intensity. Now, patients who are unable to exercise for any reason, such as severe arthritis or other physical or mental disability, may not be able to undergo stress testing. Now, certain other conditions may make the results of ECG stress testing more difficult to interpret. This includes being on digoxin therapy or being on beta blockers, or having pre-existing ECG changes at rest, and also to patients with paced ventricular rhythms, as those that have pacemakers. Now, what to do before the stress test? It is usually recommended that the patient must avoid eating, drinking, or smoking for at least 2 hours before the test. The doctor may also ask the patient to avoid caffeine for 24 hours before the test. The patient should also wear comfortable clothing and shoes that they may use for the exercise and to run in. Avoid using powders or lotions on the chest of the patient on the day of the test. The monitoring leads of the ECG will be placed on your chest, and these substances may interfere with the signal. Some cardiac medications may also interfere with the results of a stress test, such as beta blockers, digoxin, or nitrates. Now, you should discuss these with the doctor before the test, as you may need to stop taking them 1 or 2 days before. Now, what happens during the stress test? Before the test begins, you will be connected up to monitors that measure your blood pressure and heart rhythm. A baseline reading will be taken of your heart rhythm and blood pressure at rest. This allows us to compare any changes that may occur with exercise. Now, for the bruise protocol, the patient will be asked to walk on a treadmill for a period of time. The intensity of the exercise will be increased as you go, by increasing the speed of the treadmill or the incline. Before putting the electrode to the patient's chest, make sure to clean the area. You may use alcohol and a cotton. So this is to ensure that the greases from the patient's body would be get rid of, in order to ensure an accurate measurement of the ECG. So for the placement of the electrodes, the V1 should be on the 4th intercostal space to the right of the sternum. So first palpate the sternum, then palpate the intercostal spaces, 1, 2, 3, and 4th. Then with this, you put the C1 here. Now for the C2, it should be on the 4th intercostal space to the left of the sternum. So just parallel to the C1 to the V1. Now for the V3, you should skip this and go directly to V4. So the V4 would be placed on the 5th intercostal space at the mid-clavicular line. Now you may place the V3 between V2 and V4. Now the V5 would be placed at the level with V4 but at the left anterior axillary line. And the V6 would be placed at the level of the V5 at the left mid-axillary line. So now we'll go on to the 4 electrodes, which are for the arms and for the ankles. Now make sure to follow the label that is put on the electrodes. For this one, this is for the right and for the left. Both of this is for the ankles. So this one's for the right and this one's for the left. Now before starting the program or the protocol, assess first the blood pressure of the patient. Now the stress testing consists of exercising on a treadmill following a defined protocol, such as the Bruce protocol, over approximately 20 minutes. The test begins gently and gradually. The level of intensity is increased through a combination of increased treadmill speed and incline. Now the test is divided into 7 stages of 3 minutes, and there is also a less strenuous version called the modified Bruce. The ECG is recorded throughout and blood pressure is measured intermittently. Now the ETT might be prematurely stopped for any of the following: development of chest pain, presence of ST elevation, very deep or 2 mm or more ST depression, arrhythmias, hypotension, or if the patient becomes tired and is unable to continue. In addition, elevation of blood pressure to dangerous levels such as greater than 250 over 115 mm mercury should also lead to termination of the test. Now, what are the contraindications to testing? Absolute contraindications to cardiac stress testing include acute myocardial infarction, including the presence of new left bundle branch block, high-risk unstable angina, symptomatic severe aortic stenosis, uncontrolled arrhythmia causing symptoms or hemodynamic instability, unstable heart failure, acute pulmonary embolus, and acute aortic dissection. For the precautions or relative contraindications includes left main coronary stenosis, severe arterial hypertension, electrolyte abnormalities, hypertrophic obstructive cardiomyopathy, and uncontrolled arrhythmia. In the presence of a relative contraindication, the test may still proceed if the benefit of identifying ischemia outweighs the risk of performing the test. Now that's it for this video. Thank you for watching, and I hope that you've learned something.